and welcome to Employer Health Services monthly health and wellness update. I'm Dr. Rachel Brown. I'm the medical director for prevention and wellness. And we're going to talk a little bit about respiratory season. Absolutely. You guys know that I have been talking to you about COVID for years now. We'll do a little of that, but then I want to move on to a wellness topic that a lot of our clients and a lot of folks are coming to me personally and saying they're ready to start addressing, and that is adopting healthy lifestyles. So I want to talk to you about a few easy pointers right off the bat and some ways you can implement some strategies with your workforce, and then also make sure you are aware of the programming we have available to help you out. So let me share my screen. We're going to start talking about all those nasty respiratory diseases out there. You may have heard it called the tridemic or the triple-demic. We're talking about RSV, flu, and COVID. So there are many more viruses out there, by the way, many more viruses that may be contributing to the common cold, including rhinoviruses, adenoviruses, and other types of coronaviruses that are not causing COVID-19. But these are the three that are really troublesome. Now, what's interesting is we're beginning to see RSV and flu drop off a little bit. They peaked much earlier in the season than we're used to. We don't know if that means we're going to see another peak around February, March. Overall, though, even though those numbers have dropped, they're still higher by 7 times than they were the numbers last year at this time. And in fact, when they were at their peak back in that sort of October, November timeframe, they were 30 times higher than the rates of RSV and flu from the years previous. Okay, so this was a significant introduction of RSV and flu, and you might have even noticed that RSV was much more common among your adult workforce. It's generally something we see in children, but adults were getting it a lot more this year. So not sure what to expect. We do like seeing those numbers come down, but we don't know if that means they're just going to go back up in the typical pattern or not. Now let's talk about COVID. Those numbers have been stable in South Carolina. However, across the country, we're starting to see them rise again. So there was a big peak around October, November, along with RSV and flu, came down, but now we're starting to see it rise again. Not so much locally. Hopefully we won't see them rise again, but we are seeing it around the country. And a lot of you may have been hearing about the latest variant, XBB.1.5. All of these variants that we've been talking about really for the past year, 9 months to a year, are versions of Omicron. Okay, so the good news is we're not talking about a completely different category of virus here. We're talking about variants of the Omicron virus that we're familiar with. But the better news is it means that the vaccines work on this variant. What they have found about XBB.1.5 is that it's more transmissible than the previous variants. And I have to laugh when I say that because I feel like every time we talk about a new variant, we talk about how it's more transmissible. So this virus is learning how to pass itself around the community very, very quickly. The good news is we're not seeing that it causes more severe disease. So typical kinds of disease that we've seen in the past, for some that may feel like a mild cold, for others, it could have serious consequences, especially for our older population or our vulnerable population due to chronic disease. Okay, so still need to take it seriously. Some of you may have seen yesterday, that would have been January 9th, South Carolina DHEC released a statement and did a series of interviews re-encouraging folks to mask when they're in public, re-encouraging folks to go out and get their COVID boosters and their flu shots, and re-encouraging folks to please stay home from work and please stay home from school if you are feeling sick. So let's talk a little bit more about how we mitigate RSV, flu, COVID, other cold viruses, and bacterial infections like strep, so that you can keep your workforce working and they don't have to be home because they're ill or because their children are ill. So we're back to masking. Of course, there are no mandates. But really, this is about what level of risk are you and your workforce willing to accept? If you've got a workforce that's kind of spread out, maybe they're on the road, this isn't going to be as important as if you have a workforce that is very close together, maybe working on a line. Masking might be something you want to reintroduce or at least talk about freely so that your workforce feels comfortable masking if they want to. Okay. The other thing is testing, and we get a lot of questions about testing, especially around home testing. And we understand that you, as a leader, maybe in HR, have to navigate a very tricky protocol and policies for managing absences from work due to illness. You don't want folks coming in and getting other people sick, but you also want folks to come to work when they're feeling healthy enough. And when is that? So just a couple of tips. If someone has confirmed flu, and the way to confirm that is either through a clinical provider's impression or a flu test. They can return to work, or their child can return to school 24 hours after they are afebrile without taking medication. So no fever for 24 hours with no medications, and they're feeling better. Okay. That could be 2 days, could be 4 days. It's generally not as long as COVID. RSV, same sort of thing, although with RSV, we don't see prolonged fever. So folks may return to work pretty quickly as long as they're not too symptomatic, meaning they don't feel too bad. And really, in terms of mitigating spread, what we're talking about here is not excessive coughing, sneezing, lots of secretions that could spread, as you see the gentleman is doing here in my slide, and cause RSV to spread throughout your population. So again, kind of tricky there, but maybe we're talking about 1 or 2 days out when someone has confirmed RSV. And again, that can be tested, or it can be a provider's clinical impression that they have RSV. When we're talking about COVID, I think we all know the rules. If you've got a positive COVID test, then you need to stay home, isolate from 5 days from when your symptoms started or when your test was positive. If you don't have symptoms, you can return to work after 5 days if you don't have a fever any longer and you're feeling better, but you need to continue to mask for an additional 5 days. And really, in this second 5-day period where you're released from isolation but still infective, we encourage folks just to minimize contact. Okay, this is not the time to get on a plane. This is not the time to go to a family event. And if you have to be out and about among others, then wearing that mask is imperative. Home tests can be a little bit tricky, one in terms of documenting and logistics for you all, but also because we do find this story, right, happening all the time. Well, I tested once and it was negative, and then I tested again a couple of days later and it was negative, and then I tested a third time and it was positive. That happens all the time. It is not an indication that these tests are poor. It's just an indication that there's a lot of variability in the home tests, and a lot of user variability as well. So there are recommendations that if someone does have pretty typical symptoms of COVID and they test negative the first time, that's okay, that they're likely negative, but that they should continue to test maybe another time, maybe even 3 times over the course of the next 5 to 7 days, just to be sure. As always, if you have questions about testing protocols, please reach out to me and I'm happy to answer those for you. We sort of addressed return to work. That's mostly when folks are afebrile. If they have COVID, it's after that 5 days of symptoms, and it's when they no longer, or excuse me, 5 days of isolation, and it's when they no longer have severe symptoms. There's some very interesting news on the treatment front. Treatments are important. Medications can be very helpful in further reducing the likelihood of severe cases of COVID, especially in folks who are at risk. So again, our older folks, the age over 65, or folks who have chronic conditions that make them vulnerable. There have been IV remdesivir treatments that folks have done in the past. That, of course, is not as popular anymore because it's a 3-day visit to get that IV medication. And we've now got an oral medication that most people know as Paxlovid. There is one other oral medication that can be used in folks in women who cannot get pregnant. And there's even some research coming out about an oral version of remdesivir because it is so effective. So there's treatment out there, and I would encourage you to encourage your workforce to seek treatment so that they feel better, they recover more quickly, and they don't have as much of a chance of having long COVID. All right, let's move on to something not COVID related. So it's January, and a lot of individuals, a lot of work units and departments, and a lot of organizations want to begin to address adopting healthy lifestyles. Weight loss, of course, is the one I hear the most. Maybe folks want to start sleeping better. Maybe folks want to start doing a little bit better with their eating habits. All kinds of New Year's resolutions out there right now. And it is a time to reset. It is a time to think about what's going to be the best for me as I move forward in 2023. Well, we have lots of answers for you, and we have lots of answers for your workforce. So let's talk. I'm going to give you a few just high-level cheat tips that you can take personally for yourself if you're trying to adopt healthy lifestyles. But also, let's talk about how you might scale that up for your workforce. So I will tell you that when someone comes to me and they tell me that they want to get on the healthy train, the first thing we start with before we even begin talking about what they put on their plates or how they're going to exercise is, are they hydrated properly and are they getting enough rest and rejuvenation? So that's going to be number one at the top of my list, and it should be the number one thing at the top of your list. Here's a little bit of a cheat formula to know how much water or healthy fluids to drink during a day. You take your weight in pounds, half it, and that's how many ounces of water or healthy fluids you should drink in a day without going over 100. And if you've got things like congestive heart failure or other fluid imbalances, you need to talk to your doctor about that. But in general, that's a good way to know. Now, when I calculate that for most people, their eyes get huge and they think, I can't possibly drink that much fluid. So you're going to have to baby step into that. And it may not be that you start at that number, but that you work towards that number. But that's going to feel very different to you. And once your body's hydrated, it can then do all of the things it needs to do to process healthy nutrition that you give it, to manage that exercise, to lose the weight you want to lose, to be cognitively aware, and to sleep better. And speaking of sleep, you can't do any of the things you want to do without proper rest. And most of us walk around not properly rejuvenated. What we have to understand, and what I teach kids when I do these modules for young folks, is that taking a nap and getting enough sleep in the evening is exactly like plugging in your phone. Your body takes that time to fix all of the physical and emotional micro traumas it has suffered that day so that you can literally be healed for your next round, for your next day. So if you think of it that way, none of us would want our phones to be unplugged at night. In fact, on those rare occasions when our phone doesn't charge, something happens, we forget to plug it in, we freak out, right? We need to feel that way about our bodies. Get enough sleep. And that's different for everyone. For folks who are adults, it's somewhere between 7.5 and 9 hours for the most part. So that's where we start. Now, how do you help your workforce with this? Well, making sure that they are educated, first of all, making sure they have access to hydration. So bring back the old water cooler, make sure that your vending machines have healthy fluids in them, and making sure they have the time to go and hydrate, especially if they're in a setting where maybe they can't have a water bottle by them at all times. Maybe they can't have food or drink nearby. So make sure they're getting plenty of time to leave and hydrate. And as folks begin to hydrate better, it means they're going to have to excuse themselves more often. So make sure they have the time to do that. We say this tongue in cheek, but I have a lot of people come to me and say, I can't drink enough fluids because I know I'll have to get up and go to the bathroom all the time, and I can't do that. Make sure people are allowed to leave. Sleep and rejuvenation are a little bit tough. We obviously can't follow our workforce home and make sure they're getting enough rest. We certainly can educate and we can encourage. But there are ways to build rejuvenation periods into the day, into the week, into the months, and into the year to make sure folks are taking some downtime. Rejuvenation rooms are a simple way to do that, but we have other strategies to help you build that into your typical work day and typical work week so that folks are not feeling burnt out by the end of the day. So that's tip number one. Tip number two, folks will ask me, all right, I want to start eating healthy. That's it. I'm just going to eat salmon and I'm just going to eat vegetables. That's all I'm going to do. And of course, that doesn't last very long. So I tell people, again, baby step into these healthy habits. So let's start with these two things. Let's just start with snacks and breakfast. Forget everything else for a while. So with snacks, all I tell them to do at the beginning of their process is just add a protein in. Okay, now ultimately we're going to want to get rid of some sugar. We're going to want to get rid of fat. We're going to want to get rid of added salt. But just adding a protein to whatever you snack on is going to make the best difference in the beginning. Then ultimately we'll massage that snacking habit so that you're really eating some healthy things there. So start with a protein during your snack. The second thing is I teach kiddos 3 out of 5 healthy breakfasts. And what this means is you got to have at least 3 things in your breakfast. A grain, and generally we try to stick with a healthy one, right? So whole grain, oats, that sort of thing. Either a fruit or vegetable. Maybe you're like me and you're not a big fruit fan, and so vegetables make more sense for you. And a dairy or a protein if you can tolerate dairy. That's where your protein is coming from. So an example would be, for instance, turkey on a whole wheat English muffin with, let's say, some carrots on the side. Legitimate breakfast, even though it doesn't sound like breakfast food. If you model your breakfast after the 3 out of 5, a grain, a fruit or a vegetable, and a dairy or protein, you are setting yourself up for the best day in terms of your nutrition. So start there. Obviously, when you master those, we got to move on to the other meals. Same kind of thing. An overhaul is not going to stick. So I start and progress through very gradually so that we can adopt those healthy habits that are going to stay around for a long time. The first one is, let's just talk about proportions. And what I mean by that is not portion size, but relative to each of the items on your plate, what is the best ratio of the types of foods? So for any of you who have ever visited the choosemyplate.gov site, you can see here, they've changed it from the food pyramid to a plate, since we eat off a plate and not a pyramid. And basically what you want to do is make sure half of your plate is fruits and vegetables. Easy peasy, right? A quarter of your plate are those healthy whole wheat grains, brown rice, healthy pastas, and healthy cereals. And then another quarter of your plate, maybe a little bit smaller, is your protein, which can be meat, it can be eggs, it can be nuts, it can be fish and seafood. Now you'll hear with the Mediterranean diet, folks will say, make your meat your side dish. And that's basically what this plate is telling you to do, right? And that's not generally the focus of our meals. We generally have meat as the center of our meal, or a protein, I should say. And then somewhere in there, a little bit of dairy. So making sure you're getting healthy amounts of low-fat cheese or milk and so on. Then once you get your proportions, okay, so half my plate is fruits and vegetables, a quarter grains, a quarter protein, and I've got some dairy in there. Then I can start looking at portion sizes and saying, maybe I can pare down a little bit in each of these categories. Now, in order to keep the same proportions, if you pare down, you got to pare down everything, right? Then you can look at what your options are, swapping out healthy options. And the reason I don't encourage this with most of the folks I work with right off the bat is because most folks have struggled over and over again to try to change their eating habits. And they know they don't want to have that feeling of missing out on the things that they love. So if we can work on a healthy breakfast, healthy snacks, the right proportions of foods, and maybe smaller portions, now we've kind of gotten ourselves in that place where we're feeling better, we're feeling empowered, and it might be time to switch out some of our favorite foods for foods that have less salt, less sugar, and less fat. And then the last step, because it can be confusing for folks and also can sometimes be costly for folks, is to switch to organics and more natural foods. Anyone can do these steps. in this order or any order they want, but this is where we start. Now, how do we help our workforces to do this? Again, education, but also making sure we have healthy vending, healthy food options. If they're getting food outside of the office, we can talk about brown bag challenges, or we can talk about how we map out the food sources in the area so folks can get the most healthy options, all kinds of ways to empower your workforce to make healthy choices around their eating. Now let's go on to physical activity. This is my favorite. This is the one I like to do, but not everyone likes to exercise. And in fact, I rarely use the E word. I like to call it physical activity because I don't want folks to immediately think exercising means you got to join a gym and you got to go there for an hour and a half until you're about ready to pass out, work out that hard. It's really not about that. It can be very small bouts of physical activity throughout the day, and it can be things that you love. So one of the things I love to do with individuals, with departments, and even with organizations is design fitting in fitness schedules for them. And you can see here, it's really just about 5, 6, 7 minutes of different types of movement. So movement that gets your heart rate up, movement that provides resistance for your upper body, lower body, and core so that you can strengthen those muscles, and movement that allows those muscles to stretch out, scattered throughout the day so that nothing's intimidating. And in fact, this is an example of a plan that I used with a woman who was very busy with her career and her children. And we figured out how to incorporate this into things she's already doing. Like, for instance, what can she do while she's cooking dinner, or what can she do while she's driving into work, those kinds of things. So exercises, physical activity, even in the car, we can do this. We can make it work for you. But fitting it in is important because many of us don't have the time to carve out each day to do this. I will say the recommendation is about 150 minutes to 200 minutes, depending on how vigorous your activity is in a week. Okay, so about a half an hour a day can get you where you need to be, maybe a little bit more. We can come and work with you on this. We can do exercise sessions. We can do yoga sessions. We can do stretching sessions. We can do this in person. We can do this virtual. So there's lots of ways to bring this culture to the workplace. And maybe those are even moments where they find rejuvenation. They take a break to do some of these things with us. Finally, healthy habits mean also connecting with a provider. And for those of you who have engaged with us and have on-site clinics, you know that this is very important to us, that the workforce is getting the attention they need and is getting plugged in with a primary care provider. You see a resource here. Any one of you or your team members, your employees, can click on that resource to get set up with a primary care provider who can help to provide and schedule all of the services you see listed here on the slide that we all need, men and women, every year to make sure that we're healthy. Or please talk to us about establishing an on-site clinic or even a direct primary care offering where we provide that primary care service for your workforce and we become the medical home for your workforce. Excuse me. Lastly, let me talk a little bit more about some of the other programming we have. These are group programs that involve that and leverage the support that groups can give to each other. So we provide education, we provide resources, we provide management and health coaching, and the group provides support to each other. So our Lose Well is our 13-week weight management program. Choose Well is a customizable healthy eating, physical fitness, healthy lifestyles 4-week program where you tell us what would you like to happen in those 4 weeks? What would you like for us to talk to you and your workforce about? Fit Well is our physical activity 4-week program, and they do a lot of talking about how to fit fitness into your regular day. And then finally, we have health coaching available as well. Now, this will be usually more one-on-one, again, can be in person or virtual, and can be tailored to whatever the issue is for that particular employee. So you can see we've got a lot of ways to address anyone who's interested in adopting healthy lifestyles this January and who doesn't want us to do the old, what I call January 2nd phenomenon, where we decide we're going to do an entire overhaul, and then by the end of January, we're back to square one. We want to adopt those healthy lifestyles for life we can help you with that through programming. The last thing I want to share with you is we have a new YouTube video that summarizes the services we offer that you're going to want to take a look at. I'll go over here so that you can see it. You're going to want to take a look at this YouTube video. It will explain all of the services we have. This is important for those of you who are engaged with us, as well as folks who don't already have services with us, because we're developing new ones all the time. And so you're going to want to get a sense of what can we offer? What can we do for you? We want to help you out. And as always, if you head to our Employer Health Services, note the name change. We're no longer Business Health Solutions, we're Employer Health Services webpage. You'll see right here, contact us. If you click on that button, you're going to have a direct line to our department so that you can ask whatever questions you need asked. Maybe that's a consultation with me around COVID protocols, or beginning a healthy lifestyle program, or building a culture of wellness. Maybe that's working with our team to bring you the programming we have available, to establish an on-site clinic, perhaps, or maybe even to set up a direct primary care clinic for you and your workforce. We're here to care for you so you can care for your employees. I hope this has been helpful, and I will see you again in 2 months.